Okay, we finally made it to chapter 17. This is all about marketing. So, this was our last big lecture for what is going to be on your final exam with marketing. So, marketing, I think, is a really fun topic to talk about. There is a lot of maybe public policy that we can put into place to help decrease advertisement to children, to really help lower the impact on food choices. So one of the things that we did not get around to talking about in class, because I wanted to focus on how do we educate reading food labels, was talking about market segmentation. So this is the marketing that we would do for our services. So just as you all wrote up your nutrition education program plans, market segmentation is a tool that we would use for who are we going to provide this service for. So we're going to take maybe the United States population, and then we're going to narrow that down to the elderly population. And the elderly is a market segment of the big picture of the United States. And then if we wanted to market segment that even more, if we have elderly, then we want to look at elderly who just have heart disease. So that is a way of dividing a community into a smaller group, and then we're going to provide education to elderly in the United States who have heart disease. So that would be our market segment. This is based, and then we can base our program off of that particular area. When we're marketing, we use the 5 Ps. Make sure you know the 5 Ps for the final. I know for a fact that you have to know the 5 Ps for the RD exam. The 5 Ps are what we use for social marketing. So social marketing is going to be that nutrition education program that we're talking about. So how do we market that program? We're going to look at the 5 Ps. So the first one is product. What are we going to sell? Are we going to sell education packages? Are we going to sell client counseling? Are we going to sell a product? So product is what is being sold. The second P is price. At what cost? How much are we going to sell this good for? How much are we going to charge for an enrollment fee in this program? How much are we going to charge for counseling sessions? Place is the next P. Where and how can it be purchased? Is it going to be available in the grocery store? Is it going to be available in a private home? Is it going to be available in a community center? Sorry, that is important to address. Fourth P is promotion. So how are consumers going to learn about your product? Are you going to advertise on commercials on TV? Are you going to advertise in local doctor offices? Local doctor offices are always an amazing place to market your services as a dietitian because you can get direct referrals from that MD to your clinic. The final P is position, which they actually added this since I've been in school. It was the 4 Ps, but now it's 5 Ps. So position is talking about how does your product compare to somebody else's? So for the two groups who did elderly populations for your nutrition education programs, I'm just going to pick 2 random names. If Jane Smith and then Chandler Joe both had education programs for the elderly, what are they going to do to compete? We can look at this at an even more simple level where we look at how Coca-Cola and then how Pepsi competes. What does that product look like in the market? Who is going to get advantage? How are you going to stand out against all the other nutrition programs provided? Especially if you decide to go into private practice in San Diego. There are a lot of dietitians and nutritionists and holistic health coaches in the San Diego area. So how is your product going to be different? When we look at the 5 Ps, they actually co-align with the consumer Cs. So the consumer Cs are customer solution. So your product is the customer solution. And then the next one is customer cost. So your price and customer cost, that's what the customer is viewing. The customer is going to view your education or your counseling, your client, based off of their values. What do they believe is going to add to their life? Convenience is going to be for place. So place is our P, and then convenience is the consumer C. A client will not drive out of their way to go see a dietitian. They want it to be very convenient. So if you can be in the doctor's office, even better, where if they have to drive to a separate location, they may not be as willing to participate. The fourth C is communication. So that's our promotion. Promotion goes with communication. With the population or the consumer, they want to know, how is this message being communicated to me? And then finally, change. That's what they're looking at with the position. So position and change go together. They want to know, how is this education program going to change my life? Or how is this new product, like a protein bar, going to change what my issues are? That's really what we're looking at, the social P's and the consumer C's. So make sure you guys know both of those.